if they really need treatment. At what point does something that you think may be, kind of a nuance or a nuisance, turn into an actual problem? In the psychology world, we measure that based on two factors. Okay, so what we're going to talk about today is barriers to treatment. We all probably know somebody who we think maybe need treatment, or possibly we're thinking about treatment for ourselves, but just aren't quite ready to take the leap yet. And usually that's because there's something interfering with your ability or the other person's ability to move over from preparing to do something into an action state to make an appointment for help. So we'll talk a little bit about, what those barriers may be in different situations to help you and others overcome them, because I really think that there's a lot of people that need help out there that are not initiating it for a variety of reasons. The first reason, I think there's a lot of people who just aren't sure if they really need treatment. At what point does something that you think may be, kind of a nuance or a nuisance, turn into an actual problem? In the psychology world, we measure that based on two factors. One is, does this problem cause distress? Does it cause distress for you or for other people? And that's really key right there. We're more aware, obviously, of when something is distressful to ourselves, because we feel that in the form of depression or anxiety or irritability. So we live with that, and at some point it becomes uncomfortable enough that we're willing to seek help for it. It gets a little trickier when your problem becomes distressful to other people, and maybe you don't have the insight into why that is, or how that's happening, and how much responsibility you have in that. So basically, if there's a pattern where your behaviors are causing, other people to come to you and say, look, this is what you're doing and this is how you're behaving, and it's really impacting me in a negative way, whether it be your spouse, your children, maybe even coworkers. Usually it's an issue that you might want to, get help for, to look into a little bit deeper. If it crosses boundaries, if it's global, if it's affecting your family, and then you're seeing these patterns with your friends over the years, you're seeing the same pattern at work, there's probably something going on, with you that you may not even have insight into. You may not even have awareness of it. So sometimes people go into treatment for that reason. It's rare, just simply because they don't have the insight. We see this often with addiction, especially where when somebody is really entrenched in addiction, they, there's a lot of denial there. So, and they're encompassed in, the disease of addiction. So they're not able to see clearly. But obviously, they need help. So distress is the first thing. The second thing is impairment in functioning. If the difficulty that you're having is starting to impact your functioning in different areas of your life, whether it be socially, academically, occupationally, financially, just emotionally, for yourself, if you're so, say depressed that you're having a hard time getting out of bed in the morning, taking care of your activities of daily living, showering, eating properly, just doing the things that you need to do in a day, then it's impairing your functioning, and it indicates a need for treatment. So those are the two big ones from a clinical perspective. Does it cause distress for you or others, and or impairment in functioning? So, if you have some understanding of that, it'll give you a better idea of whether or not you need treatment or not. Another barrier to treatment is fear. It's scary. Like, it's scary for people to A, admit that they have a problem, and then B, go to somebody and make themselves vulnerable and open to self-reflection and self-awareness. It's work. Like, therapy is not fun necessarily. Like, it doesn't feel good all the time. It can be hard work. And most of that work happens between sessions. So, you're in therapy for 1 hour during the week, and the rest of the work happens in between sessions. And it takes up a lot of emotional energy. Sometimes people just don't feel like they have that emotional energy at the time. And if they're very defensive and not able to really look at their issues in an open way, the idea of going to a therapist and dealing with the reality can be, it's scary for people. So it's understandable that, sometimes people just aren't ready for it, or, they might not be open to it for that reason. On the other hand, if they don't, then they just continue suffering, with the issues that are causing them distress. There comes a tipping point at some point where the distress becomes so great that they're willing to overcome the defensiveness and the fears to get the help that they need. There's also a stigma, unfortunately, against mental health treatment. It's come a long way. Like, I've been in this field for 30 years now. I was just thinking about that the other day, and it's kind of crazy. 30 years, but in 30 years, things have changed a lot. Like, when I started in the field, it was very different. It wasn't openly talked about. Employers didn't encourage people to get help. It was seen as something that people do when you're crazy. But, things have improved. People are more open to it. But there's still a long way to go also. I mean, you look at the situation with veterans, and the suicide rate, that we deal with, with the military and with teens right now as well. And we know that there's still a stigma out there. People are still reluctant because they don't want to look crazy. They don't want to look weak. And what I say to that is, it takes a lot more courage to seek help and deal with the problems that you have, than avoiding it. It's exactly the opposite. To be willing to really take a hard look at yourself and get help for yourself takes courage, and it takes strength. It's just a matter of kind of a reframe on that. But it's hard, when society tells you otherwise. I think for men in particular, it can be difficult because it goes against some of the, the societal norms for men of what is strong and what is weak. But strength is a willingness to really honestly look at things and get help when you need it. Another thing that gets in the way of treatment is cost. So it can be costly, especially if you don't have health insurance. Some places do offer a sliding scale. So if you call and you say, I don't have health insurance, they'll have either self-pay rates that are usually reduced to make things more affordable, or a sliding scale rate, which would be based on your needs at the time. And usually that just requires a conversation with the staff at the office. If you have insurance, what you would need to do is call the number on the back of your card, and it'll say mental health benefits, and you can find out exactly how much is covered for whatever level of care you're looking for, whether it be outpatient, intensive outpatient, or inpatient treatment. And they can tell you what your copay is, what your deductible is, and so forth. There are some free options out there. There are support groups, particularly for substance abuse. There's AA and NA, which is free. There, for people who are victims of rape and other crimes, the Victim Assistance Center, has grant funding to help people access treatment. I think there's and then, of course, if you don't have insurance and you can't afford treatment, you might qualify for Medicaid. So that's something to look at, that would help with the cost as well. Time. That's a tricky one. I personally think that, sorry about that. I personally think that when something is important enough, we put priority on it and we make the time to do it. I mean, outpatient therapy is literally an hour a week, an hour every other week. I think we all have that. If we look at the time that we spend on our phones and, 4 or 5 hours a day, it's kind of scary, scrolling and playing games and stuff like that. Most of us have the time. Some of us, it is difficult. I do get that. Everybody's life, is a little bit different, but it's about, really making a priority to make it happen. And now, since COVID, we have teletherapy, which makes it much more convenient. I mean, it used to be this is one good thing that came out of COVID. Prior to COVID, people would have to come to my office to see me. They have to leave work early. There's drive time there and then drive time home. It would take up like half their day to come to an appointment. Whereas now you can just click on. I have people during their lunch break, they make it happen. They sit out in the car and they have a session with me, or at home, they'll go out and, in the backyard and talk outside, or in the shed in the backyard. Like, when people really want it, they make the time for it. So it's about making it a priority, really. There is misinformation also about what therapy is. If you look at the media, like how they portray therapy and psychologists, it's kind of embarrassing at times. Like, often we're portrayed as being incompetent or unethical, or just in a way that ineffective, I guess. So therapy, depending on the type of therapist you see, it can look a little bit different, but it is a science-based practice. It isn't just talking. Like, I hear that a lot from people, like, I'm not going to go and just complain to somebody, or people say to me, aren't you tired of people complaining to you all the time? And I try to explain it's not like that at all, actually. People aren't complaining. They're talking to me about their symptoms. They're talking to me about things that are going on. And while they're doing that, I'm developing a diagnostic impression, a treatment plan, goals. I'm using empirically supported techniques to help people, when they get stuck in certain ways of thinking and behaving. There's a lot that goes into it. It's not just talking about what's going on in your life. We call that catharsis. That's kind of the old school psychodynamic term for catharsis, is just kind of bleh, just talking about whatever it is that's going on in your life. And there's some value in that. We all need to just get it off our chest sometimes. But therapy is work. I mean, there is a lot more to it than just that. And a good therapist will be ethical. It's not like the movies. It's not like TV. I'd say, if you're on the fence about getting help because you don't really understand what it is, the best way to find out is just to give it a try and see how it goes. There is a relationship aspect to it and a good fit aspect where, sometimes people try therapy and it's not a great match the first time. And so you may discontinue and want to start with somebody else until you find, the right specialist, the right person for you. And there's nothing wrong with that at all. But I'd say the only way to really understand it is to kind of give it a try. I'm trying to think if there's anything else. I think that about covers it. We talked about, just not knowing if you need treatment, the fear about getting into treatment, the cost, the time, misinformation. I think it covers most of the bases. what I'd say, if any of this rings a bell for you, there's lots of ways to access treatment if you feel like you're ready. I really like Psychology Today. It's an online platform, psychologytoday.com. I'm not endorsed with them in any way. I don't get any kind of benefit from referring people to them in any way. I really think it's a great platform where you can go and you can put in your zip code, and then they show you a list of different therapists in your area, what their degrees are, their bio, all their background, a photo. Some of them have little videos, what insurance they accept, and so forth. It's a great way to get connected with a therapist if you feel like you're ready. So I hope this information was helpful, and thanks for watching.